Hi everyone, welcome back. Today we're joined by Dr. Matt Bryan, Intermountain's Associate Medical Director for LGBTQ Health here at Intermountain. We're going to be talking a little bit about Pride Month and also about a couple of different things related to Pride. It looks a little bit different this year and we're going to discuss some other ways you can potentially celebrate. Matt, thank you so much for joining us. We really appreciate the time.
Of course, I'm happy to be here. And as you said, Pride definitely looks a little bit different this year, but I think we can still support our community and have some celebration about it no matter what.
So Matt, tell us a little bit about your role. I know that this role has not been around for a long time. Tell us about your role, what you do with Intermountain, and why it's so important for our community.
Of course. So I'm, as you said, the Associate Medical Director of LGBTQ Health. This role was kind of established, I guess, at the end of summer 2019 last year. And I'm not just the medical director. I have my own clinic, right? I am a primary care doctor, so I see adults for whatever problem that they see a primary care doctor for. But the majority of my patients are LGBTQ identified. So I definitely see all the issues that they come in with and their concerns and all of that. So I think my goal as medical director is to improve the quality of care as best we can for the LGBTQ population, especially within Intermountain. So I think it's really important that the community feels comfortable coming in to see our providers. And there's a lot that goes into that. But one of my biggest goals and roles, I think, is educating our current providers and future providers to make sure they are as well prepared as they can be in dealing with health concerns that LGBTQ people come in with. One of the first things that it's really important for providers to realize and come to terms with is that the LGBTQ community faces a lot of disparities. Overall, the LGBTQ community has a lower rate of just having insurance, right? Right there, you're going to be less prone to be able to come in to see a provider. Beyond that, if we break down each kind of group within LGBT, lesbians are less likely to have routine cancer screening, so less likely to get pap smears and mammograms. Men who have sex with men or gay and bisexual men have much higher rates of certain sexually transmitted infections like HIV, syphilis, gonorrhea, complications from HPV infections. If we look at the transgender community, they have much higher rates of victimization and violence against them. So when you take all that together, it's kind of a no-brainer that the mental health issues are much higher, right? There's a disparity right there. There's much higher rates of anxiety, depression, post-traumatic stress disorder, substance use disorders, suicidality, all of these things. So I think it's super important that we educate our providers as best we can so that they're well prepared to kind of take on the issues that they're going to be faced with from LGBTQ patients.
That sounds like a role that's very important, especially within our community. It kind of allows people to feel a little bit safer when they go to seek care. We do know, too, you talked about the health disparities that the LGBTQ population sometimes does not actually go seek care. Mm-hmm. Why is that, and how is Intermountain putting out education and helping people have better access to care?
Yeah, that's a very good question. I know from personal experience, from seeing my patients and also being a gay identified person who needs a healthcare provider, right? There's often fear and apprehension of just simply going to the doctor. People are scared about, being judged or being stereotyped, anything like that. And that obviously, if you're already feeling that apprehensive, you're probably not going to go into the doctor. And the reason people have those fears and apprehensions, usually it's happened before. Right? Mm-hmm. They've gone to a doctor who they say, "Oh, I'm a lesbian," and the doctor either freaks out. That patient is not going to come back to them, right? They don't feel safe there. It could be that they come out and they say, "I'm trans. Can you help me with hormones?" And the doctor says, "Well, I don't know what to do with that." That's not a great feeling either. You're probably not going to go back. So I think we definitely need to, beyond just educating the providers so they know what to do, we have to make sure the entire team is really comfortable creating a safe space for the patients to come in, right? So this is not just the provider. This is the front desk person. This is the phone center, the call center person. This is the medical assistant, the nurse, anyone who's interacting with the patient. They need to feel safe and comfortable the whole way through their visit, whether it's inpatient in the ER, on the floor in the hospital, or an outpatient clinic. We really have to do better at making patients feel comfortable and safe when they're getting their healthcare with us, with anybody.
Yeah, and everyone deserves to feel safe and like they can actually get the care they want to. Mm-hmm. Is there a way for them to actually know who's more of a provider that has either dealt with LGBTQ populations before or has more of an open mind to taking care of someone like that?
That's a great question, and we're working on that.
Okay.
But for a very transparent way, eventually what we want to see is, provider's name and like a little triangle or a rainbow symbol, something that makes it, or just like LGBTQ Competence, something that's obvious to patients. Currently, technologies, we're not there yet, but eventually, yes, we're going to have something set up where patients can tell immediately that it's going to be a good fit for them. Currently, it's kind of word of mouth. You can always call the front desk and say, "Hey, I'm interested in starting hormones for my transition. Are there providers in your clinic that can help me with that?" And even reaching out through Select Health and through insurance carriers, they can help you. They can guide you through and help you find a good provider for you.
That's good to hear, and I really love the idea that we're going to have those symbols or some sort of messaging about our doctors and providers. I think that will be really helpful. There's a lot of stuff, too, going on in June, not just Pride Month. We've seen a lot happening in the world with the Black Lives Matters movement and everything that's been happening, and these people are very much so a part of the LGBTQ population. We wanted to talk a little bit about some statistics with that group and also the LGBTQ group and how they overlap and how we should be lifting them up and supporting them during this time.
Yes, very important, especially here and now, right? I think it's drawing a connection between Black Lives Matter movement and Pride movement and LGBTQ right movement. There's a lot of things that are similar, but there's a lot of things that are very different, and I think we need to kind of make sure we understand the differences between the two. By no means do we want, in celebrating Pride and how far we've come as an LGBTQ community, we do not want to overshadow the Black Lives Matter movement. I think it's kind of a long time coming. We've had generations and hundreds of years of racial inequities that have kind of piled up and created lots of problems in society, right? Healthcare, housing, education, income, employment issues, safety, right? Lots and lots of things that this impacts. So yes, the Black community has overlapping concerns with the LGBTQ community, and I don't think it's fair to compare the two. I think it's kind of apples and oranges. But what is important, I think, to address is the intersectionality, right? And what we mean by that is it's kind of an intersection of identities, right? Every one of us has some set of identities, right? Is it related to race? Is it related to religion, sex, sexual orientation, gender identity? Ability, age, all of these things can form our identity. And when those identities overlap, it can, depending what the identities are, some identities have more disparities. They face more marginalization than other ones, right? So if you take, for example, if a Black female lesbian who's in a wheelchair, she's going to have a lot more marginalization in society compared to a white straight man, right? And for me as a gay cisgender white male, I have a lot more privilege than a transgender woman of color, and I think that's really important that we individually take a step back and kind of acknowledge our privilege and what we have and how we've gotten here, and that can help us better address other parts of our community and help them where they might need help. I think if we look more specifically in regards to health, obviously I'm a physician. If we look at health disparities and this intersectionality, it's there's a strike. The example that I'm going to bring up is HIV rates and based on race, and there's a huge disparity there. So if we take a step back and look at the LGBT community as a whole, 58% identify as white, 12% identify as Black. So vast majority of that pie chart are white, and then an eighth identify as Black. If we look at a subset, so we can imagine that would trickle down. If you're looking at just the gay and bisexual male community, it would be a similar distribution, right? But if you look at the HIV rates, among gay and bisexual men, 37% are Black and 28% are white. So there is a striking disparity there, and I think that's really important. That just because we're in the LGBTQ community doesn't mean we're immune to any of this. I think it's really important that we all kind of own our privilege and think about how we can help out other communities within our own community, and it's hard to do that. Yeah. But I think we owe it to one another to kind of work on that. And again, we've come really far as an LGBTQ community. I think we need to help out other communities that might need our assistance. So.
Yeah, that statistic is really interesting to me, that the disparity is so large with that, which brings back to the example you were talking about the health disparity to begin with the LGBTQ population and how they're less likely to go get care. And speaking of care too, I know we're in this weird land of COVID where some people are doing virtual visits, some people are doing in-person visits. How is that working with your clinic or your practice? And are people still able to access care if they've never sought out a primary care doctor right now? How does that really work?
Yes, our clinics are still open for sure. So don't be shy. There's obviously differences in risk. So if someone's a really high risk person, they're immunosuppressed, they have diabetes and cardiovascular disease, and they're 85 and all of those things, we're going to be less excited to bring them into a clinic and have them exposed to COVID, and which would impact their health more than, say, a young 20-year-old healthy person. So there's definitely all clinics, my clinic included, have the ability to do virtual visits. So I'm doing a ton of video visits. If someone doesn't have capability with a smartphone or a computer or fast enough internet, we'll call them, right? There's no way that anyone should avoid getting care just because they don't have internet or they're scared to come into the clinic. We can absolutely work around that and make sure everyone's getting the care that they need and that they deserve. And new patients as well. Always reach out. I see new patients virtually all the time. Again, ideal world, we do in person, but in COVID world, we try to make things work as best we can. And we were definitely seeing video visits and phone visits as much as we can to keep people as safe and healthy as we can.
And I think it's important to note, too, that if you're having an emergency, regardless of anything else in your life, that you should go seek care, right? It's not a time now to not go seek that care just because it might feel a little bit less safe. Our hospitals are very safe. We're taking the precautions to make sure people are safe when they come there and safe when they leave. So I think that's really important for anyone, too. So last question for you. It is Pride Month, and I know that a lot of people are a little disappointed that they don't get to experience the normal traditions. I've been to Pride every single year since I've moved to Utah, and I was a little sad it wasn't this past weekend like it was supposed to be. What are some other ways that people can celebrate with their community while still being safe?
Right. And I think that's very important because I too miss Pride. It's an amazing way to celebrate, but we have to keep our community and ourselves and our loved ones as safe as we can. Obviously, we've heard this all over the media, all from everyone. We've heard, we want to stay 6 feet away, wear your mask, wash your hands, avoid crowds, all of those things. I'm not going to repeat all of those, but or I'm not going to bore you with those because we know them. But I think there's lots of other ways we can try to celebrate and be happy about how far we've come. And some people say, I want to go to the bar. I've been cooped up for 2.5 months. I want to go to the bar. I agree. That would be fun. But a bar is not a great place to go. There's tons of people around. You're probably not wearing a mask because you're eating or drinking something. That's not a great thing to do. We know some of the data we have, it's safer to be in an outdoor environment, right? So being outside where there's a breeze is much safer than being cooped up in a small little room with a bunch of people. So I'm thinking instead of going to a crowded bar where your risk of being exposed to the virus is much higher, maybe we do an outdoor backyard get together, right? And with a smaller group of people. And if you can space out by 6 feet, great, you're doing an awesome job. If we can't space out that much, let's wear a mask and do all of that. I know it's boring and annoying to wear a mask, but you can spruce it up, pride it up, right? Put some glitter on it, have a rainbow mask. There's lots of things we can do to still have fun with it and still celebrate. As tired of Zoom and WebExes as we are, we can still get together that way, right? You want to get together with your friends and talk about the latest RuPaul episode. There's lots of things we can do to celebrate not in person and safely. Beyond even just contact with people, we can put a flag in our yard. There's lots of different pride flags. Trans pride, there's the rainbow pride flag that everybody knows. There's bisexual pride. There are so many pride flags that you can stake all over your yard. If you don't have a yard, you can put up a sign in your window, right? There's tons of ways we can support our community and celebrate and be happy that don't involve exposure risks.
Yeah, and you bring up a good point too for the flag. I think even if you are not in the community but you're an ally of the community, I've seen those flags everywhere.
Yeah.
And they make me very happy every time I drive by one. So consider that too. If you went to Pride as an ally, then have a flag in your yard or show support to your friends as much as you can. I think the Zoom calls or the in-person meetings are great. I know someone also mentioned a hot tub, and we wanted to emphasize that a hot tub, even though it seems like a great idea, is probably not, because
Right.
you're in this really close quarters together. So probably hot tub maybe in September, potentially. And last question too for you. So Pride, I know, is potentially being rescheduled to September. That can be a way that people celebrate again.
Sure.
Do you know if there's significance to the month of September, or is that more just a choice of timing?
I think it's just we're giving it more time to improve and be less risky to be out and about in big crowds. So.
Well, hopefully we all get to go to that. Matt, thank you so much for joining us. And someone did just ask a question too really quick about provider information. I'll make sure to put that in the chat afterwards for you on how you can find LGBTQ-friendly providers as well. We also still have our COVID-19 hotline available that you can call and get screened or tested. We really would like you to call ahead before you show up at a clinic. That way we can kind of help you through the process. That phone number is 844-442-5224. We also have our emotional health relief hotline available 7 days a week from 10 a.m. to 10 p.m. And that phone number is 833-442-2211. Thanks, everyone. We'll talk to you next time.